Hello, good morning. How are you? I hope you are well. Well, let's start off where we left off. Okay, last time we talked about the introduction to gynecology, endocrinology, and infertility. Let's carry on with infertility. No, it's a very interesting topic indeed. Okay, perhaps let's start by telling you what is the anatomy of uh, a female. A female has a vagina. When you go up the vaginal canal, you will find a cervix. A cervix is divided into two, endocervix and ectocervix. Then when you carry on, you go up, you'll find a uterus. The uterus is just a bag inside the abdominal cavity. And then anteriorly, you get a bladder anterior to the uterus. And laterally to the uterus, you have two fallopian tubes. These tubes will lead you to the ovaries, two ovaries on both sides. Okay, well, that's just a brief anatomy of the female sex organs. Okay, let's carry on with the basic infertility evaluation. Anatomical factors of the infertility. We'll start off there by describing the vaginal canal. Anatomical defects of it include infections, lubricants, psychosomatic manifestations, and when we go on, we get the cervix. The anatomical defects include infections as well, absent or excessive mucus production, surgery as well, uterus. Anatomical defects of the uterus will include the surgery as well, infections as well. And then the fallopian tubes, the anatomical defects of the fallopian tubes will include infections, surgery. Basically, it's infections and surgery. All these parts of the sex organs of the female. So, pelvic peritoneum, you may get adhesions, endometriosis, and of course, the complications of endometriosis will lead you to adhesions and infection as well as in the pelvic peritoneum. Ovaries, the functional disorders of the ovaries will include infections, surgery, and also you'll get endometriosis on the ovary. The pathological conditions of the hypothalamus, pituitary gland, thyroid gland, adrenal gland, cardiovascular system, liver, and kidney. These are all the systemic factors which we may want to evaluate the basic infertility on. All right, let's carry on with the immunological factors. Both male and female, of course, will have immunological factors. Let's carry on with the pharmacological factors. The pharmacological factors are of paramount importance as well. The opioids, the antiprostaglandins, chemotherapy, and antidepressants. You also have environmental factors, which include smoking and some drugs, and of course, as we have mentioned, antidepressants are part of these drugs. you know, also on these environmental factors, we may mention the previous surgery, which is intra-abdominal or pelvic, you know, also the sexual history is of paramount importance in terms of the environmental factors. All right, I think that is enough. Perhaps let's go and check